We're ready to get started now. Thank the witnesses for coming. I'll open it with a brief comment and then turn it over to my partner here, Mr. Van Halen. Welcome to today's hearing, focused on our critical health and retirement security program, specifically Medicare and Social Security. Today we welcome Rick Foster, Chief Actuary at the Centers for Medicare and Medicaid Services. Rick remains among the nation's foremost experts on healthcare policy, and we remain grateful for his nonpartisan analysis and for his returning to testify before this committee. It's good to see you again, Rick. We're also very fortunate to be joined by Stephen Goss, Chief Actuary for the Social Security Administration. Like Rick, Steve's analysis provides policymakers with an indispensable guide to the structural need for reforms. Steve, I've known you a long, long time. It's great to have you back. We appreciate your taking time out of your day to come and testify today. The failure of Washington to be honest about Medicare and Social Security and the federal budget threatens the economic security of Americans. For too long, policymakers have avoided the critical question on how the social insurance strategies of the 20th century can deliver on their promise of the 21st century. It's just that simple. The House Budget Committee has devoted considerable energy to changing Washington's culture of irresponsibility. The American people deserve better than empty promises with respect to these important programs. Earlier this year, we proposed, debated, and advanced a plan that helps fulfill the mission of health and retirement security for all Americans. Our budget charts a path to lift the crushing burden of debt, to spur economic growth and job creation, and to fix these problems. It's been a source of urgently needed debate, along with an occasional distortion or two. Both sides have engaged in the unfortunate weaponization of entitlement politics. It's bad for our political discourse. It hinders efforts at bipartisan solutions. And most importantly, it actually threatens the health and well-being of society's most vulnerable, who rely most importantly on these programs. We need a clean break from the politics of the past. And that begins with a shared consensus on the facts. So today's hearing is an effort to unpack the fiscal facts on Medicare and Social Security, two critical programs that represent a solemn commitment to America's seniors. This is a commitment that cannot be kept unless reforms are made. To help us get our arms around the magnitude of these two programs' financial help, I can think of no better witnesses than the ones we have today. It is just this simple. These are the most important programs of the federal government, right here, these two. Millions of people rely on them. They're going bankrupt. They have to be reformed in order to be saved. And it is crystal clear to anybody who looks at these numbers that the sooner we act to shore these programs up, the better off everybody's going to be. The less disruption that occurs in the lives of the people who rely on them the most. You can't help but turn on the TV and see what's happening in Italy, in Greece, in Portugal, you name it. A debt crisis is on our horizon. And a debt crisis is driven in large part because of these programs. So it's so much better for us as leaders to act like leaders and to fix this problem and do it under our own terms and our own timeline before it gets out of our control. And it's just that simple. And so hopefully we can begin a conversation with a recitation of the fiscal facts as the nonpartisan trustees and actuaries display them. And with that, I'd like to turn over to my colleague, Mr. Van Halen.